I'm Alex.
Hello.
I'm Naveen. I'm Amy.
And we are I Don't Need Painkillers. So there are other people in our group. We're all nursing majors, so unfortunately they're all doing their precepting hours because we have to get a certain amount done by the end of the semester. So unfortunately they couldn't be here today. So the problem that we're focusing on, being nursing majors, we kind of have firsthand experience through our clinicals and things that we've learned in class. So we've firsthand seen the problem of the opioid epidemic. So prescribing opioids is easy, but it can be addictive. And we've seen that nowadays it's just very easy to just automatically prescribe them and not really consider alternative methods. But by providing patients with alternative methods, they're less likely to become addicted, and those methods have proven to be just as effective. So our customer or user would be people who suffer from pain and have never taken opioids before. So non-addicts, first-time users, or people who want to have an alternative preference, but they might not be educated on the opportunities that they could have with that. And people who pain can't be alleviated by ice or non-opioid analgesics like Tylenol, NSAIDs, or ice. So with our opportunity, one statistic that stood out to us was that 46 people die every day from overdoses involving opioids. And just in 2017, out of every 100 Americans, 58 opioid prescriptions are prescribed. So clearly, prescribers are very quick to just automatically prescribe anyone that complains of pain because it's just kind of an easy way to cure it. So the issue is that organizations should be able to ensure patients that they have alternative methods, but it's not required by hospitals. So if they're unable to provide this education, then patients don't know about it, and therefore they don't have access to the alternative methods.
And so our solution to this problem is to create a website/database, and what this website would do is that it would offer substitutes to patients in place of opioids, such as massage therapy or acupuncture. It would provide the patients with like a list of the alternatives with prices, because I know a lot of the times the prices can be higher for the alternatives, but it really depends on what insurance you have or what organization you go to. And it'll also educate them on how to begin the process, because a lot of the times doctors and hospitals don't have time to do that, so this would also save them that time. And also, time is money. A lot of the time doctors are pushed to see more patients in shorter amount of times because the hospital would get paid more. So a lot of the time they don't have time to educate their patients on these kind of things. So our website would be skipping a step that the doctors might not have time to do and just refer them to our website. And so our website would be updated periodically with new information, and we would also edit the website based on customer feedback. If it's not easy, we can make it easier for the patient, something like that. And also we would have to hire employees to update the software and design the website, since we don't really know how to do that.
So as Naveen was saying, I think our resources we were a little unsure about it because we are all nursing majors, so we are not very familiar with the whole how much it costs to make a website or a database, or even how to do that. So we are still in the process of looking for either like a computer science or engineering major to help us with all of that. So we did some research and found some estimated budgets. So to make a very basic website right now, we found somewhere around $500, we're thinking. But as our idea progresses and we create a database, we're thinking it would be more around $5,000. And then also there would be money towards like implementing our project and getting it more known to doctors and hospitals around the area. So.
Thank you for your time, and now we're ready for questions.
How would you get some patient to know about your website? And so the patient goes in, sees the doctor comes in, says, okay, you have a bad back, I'm making the following prescription, I'm off because I see 22 patients a day, have a nice day. And so does then the patient say, oh, wait, I'm not going to get this prescription, I'm going to go check out this database? Like, how do you get that leap, right? Because I don't know how they would know about this.
From a marketing standpoint, rather than marketing to actual patients and customers, we want to market to hospitals to create a relationship so that part of them, when they're prescribing, they're also sort of prescribing this website in a way. So the doctors would be the ones that would give them the resources of the website so that they could further on find like a place to go for like the massage or the acupuncture. So it's more so marketing towards like the hospitals and creating a relationship with them rather than the patients in the beginning stages at least.
So you're, can I follow up?
Mm-hmm.
So you're nursing majors. You've seen physicians are busy as like one-legged woman in ass-kicking contests. They have a lot of people demanding their time, and there are a lot of gatekeepers that keep. Like you're competing against Zola Medical, you're competing against, you know, like all of these pharma companies that are trying to get into the physician. So that's a hard sell. So think about like maybe how to get past that, because it's going to be hard for you to get the physician's attention or the hospital's attention, no matter how great the database is.
From a nursing standpoint, a lot of times the physicians will be the ones to prescribe it. But when you're doing the discharge teaching, the nurses are the ones who go through their list of medications, they go through all of that stuff. So yes, the physicians would be the ones marketing because they have to kind of prescribe the idea of the database to the patient and see if it would be the right fit. But the nurses would be the ones who are actually going through and taking the time to go through the discharge and explain it more thoroughly.
That's great, thank you.
Would you consider marketing through a primary care office? I'm just thinking that your patient population would be more apt to listen to their primary care doctor as opposed to, say, an emergency room or where you do see a mix of patients presenting with varying kinds of pain. And there's better relationships with patients with their primary cares.
Yeah, I think people definitely, it's easier to create trust through your primary care because you constantly see them. Whereas in the hospital, you have to kind of take the steps to gain their trust, but it's short term because you're just meeting the patient. Right. So I definitely think of primary care.
Would be a better starting point.
Yeah.
Have you had a discussion with anyone, a doctor at the hospital, nurse practitioners, about this idea to see what their take is?
We haven't talked to any physicians or hospitals. We have discussed things kind of with like the nursing faculty at UMass Lowell,
Okay.
and they're the ones that kind of encourage us to go through this route. So.
And they're also practicing nurses.
Yeah.
Right, that's a good first step.
Yeah.
That one's going to be my question.
Oh, I'm sorry.
Okay, you stole it, that's all right. I think the sense is, where's the pain? You know, who's asking for this? Is it that the doctors are asking for this? Is it the nurses are saying that there are major problems and maybe we should be intervening? Is it the folks who deliver acupuncture and massage saying, you know, this means more business for us, so when you link to us?
Yeah, I feel like it's kind of like a combination
Okay.
because I've heard doctors like complain that they don't have enough time to spend with their patients to offer them alternatives because just giving them a prescription is faster, and a lot of the times doctors are pressured to go through patients faster. So that would like be taking pressure off them. And I know a lot of nurses who complain about giving patients opioids like just because it's easy, but they don't really want to do that.
Yeah, I don't see my doctor anymore if I ever go and see the nurse practitioner.
Yeah.
One other question is, a lot of insurance companies are trying to look for alternatives, right? Have you looked to see or solicit some feedback from like Blue Cross Blue Shield, for example, as to what their thoughts would be?
We have not, but that is a very good.
Is that way you could get it from two
Another
angles?
way,
If you
yeah.
do it from
Especially because
the
they would be
hospital
separate.
side, the physician nurse practitioner side, as well as getting a suggestion from a Blue Cross Blue Shield to say, hey, look at this before you actually ask for a opioid prescription.
Yeah, definitely.
And they might actually be a source of funding.
Yeah.
Because it'll save them some money.
Yeah.
Maybe,
True.
maybe.
Yeah.
Was your expectation that on your website you would have people offering acupuncture and massage, that you were going to vet them and curate them? Or if I offer acupuncture, do I just pay you to be listed on your site? Have you thought through that part of your business model yet?
Well, I think part of it, we haven't like completely thought about that, but we were thinking that if we did offer this service and like said like, oh, we'll put your chiropractor or like acupuncture on our database, like we were talking about how much we could increase their business too. So it's definitely something to think about if it would be realistic to charge them to like be on our database, because we think it would increase their business as
Well,
well.
that is a business model.
Yeah, I mean,
That-
it
that
sounds-
all the platforms that exist do that.
Yeah.
They collect fees. But that's why I asked about curating, because if you can go down the path of where you're sort of the neutral organization, and you have to curate who's on there versus, like if you look at a care.com, which lists all sorts of people who provide home care services, yeah, they just provide the platform, okay? And people, pay to be on it. So that's, if you have someone involved from the business school here, they'll be able to help you with that.
Definitely.
Yeah.
Because there's a technical side to do the work, but then
Exactly.
there's the whole business side of how do you make money doing this, so where's the funding?
100%, yeah.
Which is not our forte right now. Nursing.
Exactly, nor should it be.
Are there other websites or applications doing this that you would consider with whom you'd be competing?
So none that we've come across or that we know about are comparable, because I've done like a search trying to find competitors, but I don't want to be like 100% sure, like no, there's none to our knowledge.
Okay.
Especially none that are actually partnering directly with physicians and hospitals. That's where it would kind of stand out from if there is any competitors.
Any more questions?
No.
In which case, thank you very much.
Thank you.
Thank you.
Thank you.
Thank you. Have a nice day.